Okay. Why is it not on Facebook? It's just on YouTube. Okay. It's trying to go on Facebook now. Okay, it's time. Are you ready?
Yes.
Okay, it's 5 minutes past the time. Okay. I'm trying to go back in. Okay. Okay. Are we good?
Yes, we are.
Okay. So I'm good. So what if love isn't just about chemistry, but about genetics? What if true compatibility isn't only emotional, but biological? 1 second. I need to remove this, sorry. Disable. Okay, very good. So I'll take it again. Hello, Latifat, how are you? Okay, so I'm just gonna take it again. I needed to disable the security. So what if love isn't about chemistry but also genetics? And what if true compatibility isn't only emotional but biological too? A 2021 study published in the Middle East Fertility Society Journal found that genetic counseling and premarital screening significantly reduced the risk of hereditary blood disorders, especially in high prevalent communities. So this is not just science, it is protection. So hello everyone and welcome to Ibi Speaks. I am your host, Ibinabo Enebi, and welcome to another powerful installment of our ongoing love and relationship series. So guys, if you're new to Ibi Speaks, you can just go to my YouTube channel, Ibinabo Enebi, and go to the Love and Relationship Podcast, and you would see quite a few episodes that I've done so far. So at the end of today's conversation, you're going to learn, oh my God. Elder
You're
sister.
going to learn what?
It's my elder sister just called me. Give me a minute. Isn't this amazing? Live, and my elder sister is calling me. Guys, life just happened. So at the end of this conversation, you will learn why medical and genetic compatibility can shape the future of your relationship, the risks of inherited conditions like sickle cell anemia and the thalassemia, and how screening can prevent future heartbreaks for couples and their children, and what communities and couples can do to make informed and compatible decisions. So, in case you're wondering what Ibi Speaks is about, on Ibi Speaks, I feature everyday people like you and me and thought leaders whose experiences and expertise serve as streetlights and survival kits for those coming behind us. And my guest today is someone whose wisdom spans continents and decades. And he is Dr. Abiye Hector-Goma. He is the senior GP at Allerton Medical Centre in Leeds, UK, and a fellow of the Royal College of General Practitioners with over 34 years of experience in medicine. He has worked across the UK and Nigeria, spanning public health systems, community outreaches, and private practice. He specializes in cardiovascular risks, lifestyle medicine, patient safety, health tech, and serves as the diabetics lead in his practice. And what is his focus? His focus is helping patients make well-informed choices, even in the most personal aspects of their lives, like marriage and parenthood. He's also a seasoned leader, serving as the first clinical director of Chapeltown Primary Care Network and currently chairs multiple health and faith-based boards. And today is here to help explore one vital truth: love meets science, why medical compatibility matters before you say I do. Dr. Hector-Goma, welcome to Ibi Speaks.
Thank you very much. Good to be here again.
Perfect. And guys, this is an interactive session, so feel free to ask Dr. Goma your questions, and I'm going to if you have any questions, I'm going to ask. If you have any questions, just leave it there in the comment box if you're watching via Zoom or YouTube or Facebook, and Dr. Goma would answer your questions for you. Right? Good. So, Dr. Goma, let's lay the foundation to this conversation. And let me ask you this question. Why exactly is premarital medical? So not even why, what is premarital medical screening? What does it typically involve, and how has it evolved over time?
Thank you very much. As the name implies, so we'll break it down to three. The first word is premarital, which is before marriage. And then medical means anything that happens when you interact with doctors and nurses. And then screening is what you do to detect something before it happens. So treatment is something that's happened and you want to find a solution to it. So screening, medical, premarital. So it is the checks you do before marriage, looking for genetic problems, infectious and chronic diseases, those checks that you do before marriage. Now, it's evolved from the basic health checks of just doing blood pressure and height and weight measurements, maybe checking cholesterol. And now we have genetic testing, and in fact, we now have what is called NGS, which is even the higher level of testing about things that would happen to your great-great-grandchildren. So that's the kind of sequential, all this genomics that is happening. So that's the kind of the future of testing. But that's just what it is, looking for medical, looking for genetic problems, looking for chronic problems, infectious diseases before you get married. And I was thinking about it, Ibi, that if you're going to buy a house, you have all those things that they will check. Is that house in a flood-prone area? Is there a mining history of mine? Is there a mining town, history of mining? There are so many questions. You want to go and take a loan. I was trying to take a loan for something the other day, and they asked me so many questions. So the point is that if for non-life things, a lot of questions are asked before you make a decision, how much more when it comes to something that has to do with your generation and generations yet unborn. So premarital screening, medical screening is about looking for genetic, infectious, and chronic diseases before marriage.
Dr. Goma, I like when you said that the pre-medical screening goes beyond your height, your weight, your cholesterol, and all those type of things, because I just realized that really sometimes when you talk about medical screening, that those are the kinds of things that we look at. So you're saying, therefore, that pre-medical screening before you say I do is beyond hypertension, it's beyond cholesterol and all of those stuff. How deep is it?
Okay, I would say that,
How
yeah.
deep can we go?
Yes, there's some basic things, you know, it's like let's start with your past history. Before you say preconceptual health check, premarital screening, you want to know, do you have any existing gynae problems which may affect your fertility? Because for a lot of us who come from cultural backgrounds where having a child after marriage is important, if there are existing gynae problems in the woman, if there are existing problems in the man, and if you can get to know those problems and fix them, then the chances of not having a baby tomorrow are reduced because you've been wise enough to make those checks. So the past history is important. A woman's past menstrual history is important. Any history of diabetes or maybe thyroid disease, for example, how you manage such women when they get pregnant tomorrow is so different from if you don't know that such things already exist. So that is the first one, the past medical history. Then medication history. Somebody may have a history of depression and they're on some medication. If they're planning to get pregnant tomorrow, we may have to stop those medicines or switch to different medications. If they're on blood pressure tablets before marriage, they may have to switch those tablets because some blood pressure tablets are okay in pregnancy, some the risk for the baby is higher. So medication history is important. And then something as simple as height and weight, the body mass index. A woman who is living with obesity is more likely to have issues with getting pregnant than a woman whose weight is within normal limits. So preconceptual health check involves helping a woman to try and get her weight down because that increases her chances of getting pregnant. So lifestyle issues about diet, exercise, smoking. When a woman is smoking, it affects her, it affects the baby. So helping her to stop smoking before she even thinks about getting married is important. And then things like immunization, MMR, you know, mom's measles, rubella vaccine, it's important that women have them because if a woman does not have those vaccines and she gets pregnant and gets exposed, that child is going to be deformed. And that's why such things are important. And then basic things like STI screening, you know, is that chlamydia, is that gonorrhea, is that HIV? Nobody will want to get married if you know this person has HIV. So just a few examples that need to be done before we now talk about the genetic screening, looking for genetic compatibility, which I guess is the main thing we're going to focus on. But all these are bread and butter basic things. And then we look at mental health assessment. You know, somebody who has mental health issues, pregnancy brings on a whole load of problems. So being aware of mental health issues in a man or a woman, a man needs to support his wife. And if a man is already struggling with his mental health, and then a woman now gets all the hormonal challenges of pregnancy, you now have a man who cannot support a woman in that kind of state. So knowing the mental health issues of the man and the woman ahead of marriage, having a plan for it is really important. Then we talk about the physical examination, checking the body and things like that, blood tests, things like folic acid is mandatory before pregnancy and in the early stages of pregnancy. Things like vitamin D could help people get pregnant. You know, the likelihood of pregnancy is more, and then if there are any specific concerns to address them. So really, preconceptual health check is actually giving the baby the best chance in life for tomorrow and giving the couples the best chance to stay together after marriage.
Fantastic. Wow. Like, you know, when I was thinking about this topic, I it was very interesting for me because I was thinking, I really want to know if all of these are important because when I got married, you're celebrating your 30th anniversary this year, and me too. We never thought about these kinds of things. You know, all we knew was that once you had parental um, agreement, you know, they advised you when you go live in peace and all those things, and that was it. Like we never really had any of those things. So this is an eye opener. Yeah, are you there?
Definitely.
It is an eye opener, and like I said, I'm here to learn today. Now, I think that you've answered the second question I want to ask you, but I want us to focus on it again. So why is genetic compatibility an important part of choosing a life partner? Shouldn't it matter? Should it matter as much as emotional and spiritual compatibility? You touched on it, but I want us to kind of like delve deeper into it.
Okay, thanks for that question about the
Why
importance
is
of
genetic
genetic
compatibility?
compatibility. Yes.
Yeah.
When I give talks, like you mentioned, I have a lot of interest in cardiovascular health, about your heart and blood vessels. And one of the things I talk about is the 1970 Lalonde report on the health of Canadians. Now, that report said there are four main things that affect the health of people. The first one is their genes. The second one is their lifestyle and behaviors. The third one is the quality of health services they have. And the fourth one is the environment that they live in. And I always start by telling people that, you see, you have to choose your parents carefully, because that's the first one. That's if you choose your parents carefully, you have the right genes. And everybody laughs about it because how can you choose your parents? You have no idea who your parents are until you are born. But choosing your parents carefully is another way of talking about compatibility, because medicine continues to advance. And the things that our forebears did, they did them because that's a level of knowledge that they have. But we have so much more knowledge now. Let me just digress to a condition. There are some people, when you take codeine tablets, those that take codeine, when you take codeine or cocodamol, an enzyme in the body breaks down codeine and converts it to morphine. Many people don't know that. When you take
Dr. Goma,
codeine,
just give me a minute. I'm trying to, my video on Facebook is heating.
right.
And I just feel that this conversation isn't something that is so important. I don't know why my video is not on public, it's on private. So people can't see it. It's such a shame. Just give me a minute. Just give me a minute. Wow. It's on just, oh gosh. Is locked.
Right.
Yeah, just give me a minute.
You drop the Zoom link there.
The Zoom, I should drop the Zoom link.
In the Facebook place.
Okay, I'll do that. I'll do
Yeah.
that. Okay. Because this is so, so, so important. Oh, give me a minute. It's so sad. But it's not sad. Thank you for telling me what to do.
I learned Facebook Live from you. Remember, I was trying to tell you that how do I get Facebook Live to work?
Yeah, but then Zoom made it even easier.
Yeah.
See, like this is working, but the video itself is not just give me a minute. It's not, oh Lord. The video itself is locked. I don't know how to unlock it. I don't know how to unlock it. Sorry. It was live the other time. Okay, let me just check if it's on Facebook, it's on YouTube. Just give me a minute. Sorry, because this is so important that I don't want it to be lost. 1 second. Oh. Oh.
Be live on YouTube.
Yeah, I think so.
Yeah, then you can always put the YouTube feed on Facebook later.
Okay. All right. So yeah. So just give me a minute. Oh, okay, good. I can change it. Yeah, perfect. Yeah, got it. Now it's public now.
Okay.
Perfect, perfect, perfect. Okay, good. Yeah, thank you. Okay, so I'm going to ask you the question that I asked you again.
Right.
And that's the question. So the question is, so we've talked about the importance of premarital medical screening. And now the next question I want to ask you is, why is genetic compatibility an important part of choosing a life partner? Shouldn't it just, so, I mean, once we have the emotional and the spiritual compatibility, shouldn't that be enough?
Well, like I was saying that it's great. The emotional and spiritual compatibility are actually integral, but genetic compatibility it's really is exceptionally important. It is important. I was saying that the Lalonde report on the health of Canadians talked about the four main factors that affect the health of people. That was a 1970 report. The first one is our genes, two, our lifestyle and behaviors, three, the quality of health services, and four, the environment that we live in. Now, the genes come from half from our father, half from our mother. So to have the perfect genes, we need to have perfect parents. And since we cannot choose our parents carefully, if our parents look at genetic compatibility, then that gives them a fighting chance. I will talk about a little bit more in detail. It affects the health of our children. And there are some things that don't matter. There are some things that we don't know. But the things that health, the things that science, the things that advancement have put at our disposal, it's really important that we do those things. So it's crucial and it should be considered alongside emotional and spiritual compatibility to ensure a thriving family. There are a few stories that I can share about. I've seen families, both as a young doctor in Nigeria as well as a GP in the UK. I've seen families who are bringing up children who have various levels of disability, and some of them are emotionally heart-rending. And such things sometimes can be prevented if genetic compatibility is taken into consideration ahead of marriage.
So what are some of the conditions
Right.
that that would
Yeah, they're the traditional conditions which we use like in the NHS. When a child is born, they take a drop of the child's blood and a few conditions such as cystic fibrosis, sickle
hmm.
cell disease, Tay-Sachs disease, Down syndrome, phenylketonuria, neural tube defects, Huntington's disease. Some of these traditional tests can pick them up. But that is kind of medicine after death because the child has already been born. We're talking about premarital um, screening. But these are the kind of things that happen afterwards. But now these same things can be tested for ahead of marriage. And going beyond these traditional tests, there are a few other conditions. There are things like cancer risk. Something
Hmm.
like breast cancer, for example. These are very well established now. There are two cancer genes called BRCA1, BRCA1 and BRCA2 genes. People who have those genes are at much higher risk of having breast cancer, ovarian cancer. There are tests that can show lung um, problems, colorectal, colon and rectal cancers. There are some tests that can show cardiovascular disease likelihood. Look at a condition called familial hypercholesterolemia. This is high levels of cholesterol which is passed on from generation to generation. Somebody can just eat the most healthy diet in the world and still have very high levels of cholesterol because genetically there is a substance or an enzyme which breaks down cholesterol. And for some people, that enzyme is deficient or is not working well. So it means that their body doesn't break down cholesterol. So cholesterol continues to rise and rise and rise. And with very high cholesterol level, they're more likely to have heart attack and stroke and so on. Now, there are tests that can identify that gene, you have it. And that knowledge alone will make you have a different approach to lifestyle. And that's an advantage of such things. There's something that's called prolonged QT interval, which is something you find when you do an ECG. If you've never had an ECG done, you may never know you have that kind of condition. Some medicines are contraindicated if you have this so-called prolonged QT interval. Now, if you've done checks ahead of time and you find that out, that kind of child can now grow or being informed that as you grow older, these medicines, you have to avoid them because you're at higher risk of having a sudden death. Now, that's the kind of benefit of having um, genetic compatibility test. So what are the advantages? That you optimize your health before pregnancy, you detect problems that are potentially problematic in life, you detect them early, and then you make informed choice. One aspect of the informed choice is that you guys decide that, look, this possible complication, we can't cope with it if our child has it if we get married. But the other people will say, it's not as if it's going to happen. There is a chance that it will happen. We will take our chances, but we're going to prepare ourselves for it so that if we're unfortunate enough and it happens, we are making informed choice. So I want us to get that very clear that genetic compatibility does not mean that you have to go your separate ways. You have the knowledge and you can either decide to go your separate ways or still go ahead into the marriage, hoping that it doesn't happen. But if it does happen, you are prepared for it.
Wow. It's a mouthful, to be honest, because so from where I'm sitting, I'll be thinking, so it's important then that if once a child is born, then the his GP or the medical team would have to have a catalog of all his conditions. Is that it?
No, well, the thing is that the traditional method, these checks are done at birth, even before the child is discharged from the hospital. They
Yeah.
do this test. So, for example, if the child has cystic fibrosis, straight away a plan is put for the child's future as soon as the child is born. Well, that's the advantage. That is early detection, but this is after the child is born. But imagine before marriage, you do premarital counseling, and you now realize that you are at risk of passing on the trait of sickle cell, sorry, of cystic fibrosis to your child. Now, there's something that we need to briefly explain. There's what is called autosomal dominant, which means that you have one copy of the altered gene. That one, you have a 50% chance of passing it to the next generation. There's autosomal recessive, means that both father and mother would need to have this altered gene. And if they pass that altered gene to the child, then it's only then that that child has the risk of having the disease. But if they don't pass it, if only one parent passes it, that child does not have the risk. So there are two different ones. But the point is that when you do premarital genetic tests, you can now find out, for example, okay, one parent has the gene, the other parent does not have it, which is fine. Or both of us have the gene, which means that there is a 1 in 4 chance that our child would have this problem. And at that point, the potential husband and wife to be can make informed choice whether they still want to go ahead with the marriage, or if they do get on with the marriage and the child comes down with that condition, what kind of support system is available, they can make that informed choice.
It's expensive. It's a very, very expensive situation, where a child has to have a medical condition as a result of the parents' decision to get married. And I've met two people that two of them died, actually. The two children died. One I met at the hospital. She was 12 years old. Beautiful girl. She had a crisis, sickle cell anemia. She was having a crisis. And then I had a close family member who was unwell at the time. and I would go to visit, and the girl was so beautiful. And I met her. She went to Federal Government College at Boloma and all this stuff. And I was with her, because I'm a Boloma as well. And I went out and I came back and she had died.
Mm.
And I met there's another very close friend of mine whose son passed away. It was a terrible, terrible. They'd spent everything they had. They relocated to the UK, had a bone marrow transplant, and eventually this boy died. When you're talking about the fact that when you mentioned that the parents, if both parents have a defective condition that can be passed to the children, yeah, you're saying that if we are aware of that, then the chances of managing it is there. But then that is only for people that are in advanced countries.
True.
In a country like Nigeria, is it what taking the risk?
Well, it's a good question to ask, and we need to reflect on it, because also in a country like Nigeria, we are very religious people. We are also very prayerful people, and we are very good with the phrase, "It is not my portion." So because we say it is not my portion, so having that knowledge that is not their portion, sometimes it also works for them. Now, I'll just use this research point that in some parts of the world, in some countries, premarital genetic testing is compulsory in some countries. And I heard about Kano State making it compulsory. I'm not sure how true that is. But it's interesting that in a place like Saudi Arabia, even though it is compulsory to have the test done, more than half of couples who have test results that suggest they should not be married, more than half of them still go ahead and get married. And this is where you have religious and cultural factors, because sometimes in some families it's the parents that decide who should marry who. And if your parents have decided that is your husband or that is your wife, then all this testing is not going to make a difference. So there's always an intersection between science and culture, traditions, and religion.
There is always an intersection between science and tradition. And I feel that, when I, in our culture, right, when something is happening, something happens to somebody, and in a family where they have a hereditary condition, and maybe young men could have some cardiovascular conditions and they die at a certain age, or there maybe some people are blockage of the arteries, some people are the cholesterol stuff, and then we would always say it is a strong man or a principality that has caused it. And according to what you said, you say more burufika, because like we always blame principalities and powers and evil spirits and wicked family members for a condition that would have been treated medically if we had checked the science of it. Yeah. Okay. So I want to ask this other question. And I think that you kind of like, you've answered all the questions I read. I want to say this. So, my dear listeners, you can be a part of this conversation by leaving your questions and your comments in the comment box below, and Dr. Hector-Goma would answer these questions for you. So I was going to ask you a question. What risks do children face when both parents are carriers of the same genetic traits? And you have answered the question. So how do congenital disorders develop in these situations, and what kind of long-term impact can they have on families emotionally, financially, and socially?
Right. Okay. Let's start from even doing the testing. While I've talked about the benefits of doing the testing, there are also cons to testing. Some of the more recent genetic testings, the interpretation is quite complex, and the significance may be uncertain. People end up getting so much information, which is confusing about
Hmm.
being carriers of rare diseases that even their grandchildren's lifetime may never show up. And there are also privacy and ethical concerns because some people have the insurance. If they do this testing and then something shows up, their insurance will be canceled. Employers kind of get involved. There's a misuse of information, and then the risk scoring brings up issues that really don't do. Like here, and I'm talking about Q risk. Q risk tells you about the risk of having a heart attack or stroke in the next 10 years. It's neither here nor there. So some of these things are confusing, but going on to the specific answers, there are children that are born who may have cognitive and development issues. So in terms of when some of these children have disabilities, it affects their cognition and their development. And when you have a child who is not as sharp as that child should be, for parents and for the child and for the siblings, maybe that child has two or three siblings, they are more or less ignored in the house. The parents kind of put all their focus on this child. And then sometimes this child may be fine, but then there are some conditions that become more obvious in adulthood. I talk about the hypercholesterolemia. It may not matter much in a young child and a teenager, but that person can now have a stroke or heart attack in their 30s because of that condition. So things happen in future. And then there are some infectious diseases that if the genes are right, you have protection. Your body has the immunity which
Hmm.
protects you from infectious diseases. And if the genes are not right, you now find out that some children now have reduced immunity and they have frequent illnesses. Now, in a place like the UK, where everything is provided by the NHS, thank God for that, you don't spend money. But if you're in a part of the world where even paracetamol, even cotton wool or needle, you have to pay for it, this brings a lot of distress, both emotionally, financially, to a lot of families.
Okay, so there is the rise of autism in among Black children, and could it be as a result of, especially among the Black children that are living here abroad in the West? We find out that I was listening to the news last year,
Mm.
and there was a research that said that there was a projection. I can't remember the percentage now, but that there was going to be a rise in autism in ethnic minority children by about, was it 10% or something like that, projected over the next 10 years, and that that observation kind of like jolted me to a bit, because I remember growing up in Nigeria. When I think about my classmates, I think about my primary school classmates, my secondary school classmates. We There wasn't a lot of cases of autism, or maybe because maybe it could be that maybe a child has learning disability and we'll say you're lodo and stuff like that.
Mm.
But just the rise in those kind of conditions, could it be genetically caused, or could it be just environmental?
Well, it's a combination. There is a significant genetic component to autism spectrum disorder. There's a significant component to that. And I guess as science develops more and more, and all this testing, all this sequencing gets more specific, maybe the particular genes where this is taking place will become more obvious. So yes, there's a strong genetic predisposition. But then there's also the
Of
link.
Africans, of
Well, not
Africans.
not well, not just Africans per se, because it's I don't know, I'll be honest with you, I don't know about specific increase, like you said, of 10% for Africans, but definitely even when we look at the UK generally, there's an explosion of requests for ADHD and autism testing as an explosion, right? In Leeds, for example, it's almost 3 years wait to get tested because of the explosion in requests. So
For
definitely,
sorry. Is this for Black children or
no,
just
no,
in
no,
general?
for children generally. So
Okay.
it's not race related. So I'm just saying that if there is such an explosion in the requests for referrals for autism and ADHD testing for everybody. So whether it's going to be more for Black or white children, personally, it doesn't matter much because there's an explosion for every ethnicity, not just Black children.
Wow. Okay. So, my dear viewers, if you have a comment or a question, please feel free to leave your questions or your comments, and Dr. Goma will be able to answer the questions for you. And just in case you're watching me for the first time, my name is Ibinabo Enebi. I'm the host of Ibi Speaks. And on Ibi Speaks, I feature everyday people like you and me who bring in their expertise and experiences, because I believe that collectively that our experiences and expertise serve as streetlights and survival kits for those coming behind us. And you can subscribe to my YouTube channel, Ibinabo Enebi, and you can follow me on my social media handles, Ibinabo Enebi, TikTok, Facebook, Instagram, and LinkedIn. Thank you. So, in your clinical experience, have you encountered difficult situations that could have been avoided through early screening? Now,
I mean, yeah, I'll say yes, 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 and yes. Let me start from when I was a young house officer in Ahmadu Bello University Teaching Hospital in Kaduna. This is 1989, 1990. I think I was doing my second 3-month posting in pediatrics, and there was this 1 or 2 day old baby who had a condition I got to know. I think it's epidermolysis, something like that. What it is the child's skin is very sensitive or was very sensitive. So this child at birth had very low blood, and we had to transfuse the child. Now imagine trying to clean the skin of the child with cotton wool before putting the needle. That cleaning of the skin peeled the skin.
the cleaning of the skin, peel the
Peel
skin,
the skin. That is the genetic problem the child had.
the skin.
Just to clean the skin before putting the needle. Just that gentle putting cotton wool on the skin to remove to disinfect it before putting a needle, it peeled the skin off. That was a genetic problem. This was a 2-day-old baby. I had to stop what I was doing, and I went outside the baby ward and I shed tears. And I thought, what has this 1-day-old baby done? And that has been on my mind all these years. That was my first time of seeing. And of course, the child died a day or two later. And then I remember just about that time, there was a member of staff they are both clinical people. They had 4 children, and all 4 children had sickle cell disease. So this lady virtually lived in the children's ward.
What?
One child got better, the other person had a crisis, she was back. As that child got better, sometimes 2 children had crisis, they were in the hospital. So those are 2 experiences that kind of have stayed with me. And then as a GP working in the UK, there is something that is called consanguinity, where people who are close biological relatives get married. Now, such people, there's a natural protection. Talk about genes that are faulty. Now, these faulty genes are commoner if people who are closely related get married. So that these faulty genes, where one person protects the other one, is less likely to happen. And you now have a much higher number of children who are born with various genetic disorders. And I see babies, young children, who from birth cannot raise their head as they grow older, they cannot feed themselves. And when they come to the clinic, I think about the poor mothers, that this is a lifelong prison. And those are things that could have been prevented by the decision of getting married and then by the opportunity to do testing. In the NHS, we don't do premarital testing. It is offered, people are given counseling if there's been a problem before, but there is nothing that tells you you need to do premarital counseling. But I'm just saying these are examples of where people's lives are completely taken over by the illness and disability of the child.
I have two questions, one on Facebook, and somebody's asking what causes autism?
The truth, the cause of autism actually is unknown. But like I mentioned a few minutes ago, there is definite genetic predisposition for autism. So that if you look at genetic testing that is being done, if you do a genetic test and say you took 100 children that have autism and all 100 of them have one particular gene which is abnormal, then you can say definitely this is the cause of autism. But where you have different abnormalities in different children, you now begin to put them together. So there are multiple genes which have been found to be abnormal in children that have autism, but definitely that is not all. There is also the link between a gene and the environment. If a child, for example, is being brought up in an environment where both the air, the water, and the land is polluted, this constant effect of the abnormality in the air, water, and land can have an effect on good genes and have changes in those genes, which can now lead to autism, maybe in their children, in their grandchildren. So that's another thing about the link between genes and the environment. But definitely, genes have been found to affect autism, and then the environment has also been found to affect autism. And now some people would also argue that there may be behaviors. I'm not sure about that, but some of us growing up in the environments where we grew up, where there was parental discipline, you cannot even dare to do a tantrum. Your parents will bring you to order. But we now live in a world which is more accepting of those things. So if a child throws a tantrum and throws a tantrum, who knows if there are any behaviors that can contribute to it. But what we are sure about is genes and the environment can have an effect, and hence autism.
Fantastic. So I have another question for you, or is it a comment? And somebody says, when do you think it is the right time to test for ADHD in children? Because I have also seen children who have delayed development and they are placed on the spectrum and bombarded with medication only to jeopardize the life of the child.
Like I mentioned, I think we are getting more and more knowledge about ADHD, autism. There's a lot more awareness. So the same thing that happened with things like dyslexia, and people went through life without having any assessment or without being supported. We just assume that child is a different child. But now in the UK, for example, we have something like MindMate. MindMate is a kind of a supportive website for children, for families. You have support systems from nurseries through primary school, through secondary schools, where these things can be identified early. And then from there, children can be referred on for assessment. So the opportunities for early assessment is now becoming more and more available. When I started practicing in the UK, I'm sure this was very, very few and far between. Now you have more and more NHS and even private sector organizations springing up that are providing testing for people. So in terms of to answer the question, what is the right time? I think it all depends on one, the child comes from the home. If a parent has any concern about the well-being or behavior of their child, then it's good to have an early conversation with the child's school, because in most parts of the country, support for these things the funding for them is linked to education. So if you have any concerns about the child, then discuss with the primary school teacher or discuss with whoever is in charge in the child's secondary school. They can now arrange, first of all, to link up with behavioral support for the family and then arrange testing if required. But I think it's also important for parents, don't wait. If there's a lot of information out there on autism, on ADHD, that adhd.co.uk website, that autism website, where you can get all the information that you need And because there's no clarity in the country. I'm talking about the UK now on how to manage these things. So a lot of times parents hit their head against the wall, and those parents who push and push and push are more likely to get the support that their children require.
Fantastic. Wow. There seems to be, okay, let me just take this question. Is it true that the genotype of a fetus can be altered medically? There is this couple in my estate who got married, both AS, and they know when friends and family tried talking them out, the response was that there's enough money to sort the genotype of their babies medically. They sounded dumb to me. I'm sorry. It's over 2 years and they're still trying. Thank
Okay.
you. Please keep your questions coming. I'm trying to sort out this privacy thingy. Yeah.
Okay, I know that there is something that has been in the UK recently about science has advanced to the point that the defective hemoglobin in sickle cell disease can be altered, thereby bringing it's called genetic editing. The techniques like CRIS, SPR can now allow scientists to precisely modify specific genes, leading to targeted changes to genotype. So that is now available in the UK for, I know there are a few people who have had the benefit of that, but it's not yet mainstream. So the answer is yes, science is now able to do targeted gene editing.
Science is now able to do targeted gene editing. Wow. Why are young Black boys in the UK, immigrants, more susceptible to mental health breakdown?
Well, I think it's more multifactorial. It's multifactorial, and I think let's look at what's happening in the beginning of that child. You know that evidence is that the Black woman in the UK is 3 or 4 times more likely to die from pregnancy-related complications than the white woman.
Okay.
And that probably is a reflection of the quality of care that she receives. So that's the first one. We talked about preconceptual health, and we talked about all the things about medication, lifestyle, and all of those things. So if a woman is as healthy as possible before she has a baby, then that baby is more likely to have, if the fairest chance in life. Michael Marmot is a popular name in terms of health inequality in the UK. It talks about every child having a best start in life. In the UK, that's the best way to have a healthier country. Now, a lot of the children who don't have the best start in life are those who live in the more deprived, poorer parts of the UK. And you are more likely to find people from ethnic minority communities living in the poorer parts of the UK. So the issues about damp accommodation, the issues about an environment which is hostile to normal growth are more likely to take place in those homes. Are you with me? So we're talking about the genes and the interaction between the genes and the environment. So if the woman is pregnant, she lives in an unhealthy environment, that child that she brings up, maybe there could be some gene interactions in that unhealthy environment. I don't know about smoking, I'm not sure about the kind of foods, but that is one level. Then we'll come to the next level of poverty. Again, poverty is a big issue. You have families where a woman maybe is working around the clock to make money to survive and send money home to pay for A, B, C, D. Some of these children are not being well looked after. The parental care is not there for some of these children in their most vulnerable years. There's a lot of marital dislocation. Many marriages, either for convenience or for social security or whatever. I remember many, many years ago, I had a friend who was working, a nurse who was working around the clock. The children were virtually left on their own because the person was working, trying to make money. So that parental discipline may not be there. And I'm sure in the London area, a lot of the gangs that we hear about has to do with father and mother not being there for their children. In my family, for example, we made a decision that my wife never worked full time since we came to this country. I worked around the clock, but she never worked full time. So she was always there for school run, was always there for anything child health, child education related. She was there for them. In some families, husband and wife are chasing money. The children have no support, no parental care, and such children are more likely to fall into bad gangs and things like that. And I think that these three examples of poverty, of chasing money, and not being there for the children all contribute to having children who have issues in their mental well-being.
Wow. This is a mouthful. And so, my dear listeners, if you have any questions or comments, please feel free to leave your comments in the comment box, and Dr. Abiye Hector-Goma would answer them. So many people feel that screening shows a lack of faith. Now I'm talking about people that go to church. They feel that screening shows a lack of faith, or that love is enough to conquer anything. What would you say about that?
Well, one scripture comes to mind: you shall know the truth, and the truth shall set you free. Can we have an amen in the house?
Amen. No.
You shall know the truth, yes.
Amen.
So the point is that, yes, faith is really important. Faith is important. What is faith without works? I don't know how many of us leave our doors open when we go to sleep at night. We quote Psalm 91 very well. He who dwells in the secret place of the Most High shall abide on. And at the end, we still lock our doors and go to sleep. So the point is that there's absolutely nothing wrong. The knowledge which we have from science has come from God. And at the end of the day, there's this man, this doctor in America, his name is Donald Beckwith. He said that we as clinicians, we are guests in the lives of our patients. I have patients who are smokers. They have very bad asthma or lung disease, and they will tell you they will never stop smoking. I have patients who have diabetes and they eat the most junk food in the world. And I said, as a doctor, my role is not to be a policeman for my patients. My role is to give them the information and let them have the information in a simple language that they can understand and let them make informed choice. And whatever they decide to do, I will respect their decision. I will not judge them. Let them have the information. So the same thing goes with premarital genetic counseling. I'll tell you what the pros are. I'll tell you what the cons are. You wait and make up your mind what is best for you. But I've just given examples: sickle cell disease, cystic fibrosis. These are things that we see every day. And it's not because those people lack faith, it's because they had a chance or they don't have a chance to know about this before it happened. And if you get a chance to know about it, then take the good side, the bad side, wait, and then make up your mind what you want to do.
Wow. So again, this is an interactive session. So if you have any questions or any comments, please feel free to leave your questions and your comments, and Dr. Hector-Goma would answer your questions for you. Now, in the part of the world where we come from, we spend a lot of time preparing for marriages, for the wedding, really not for the marriage. And we don't have time, or rather, the genetic testing is never in question. I think the only thing that we do generally would be, what's your blood group? Yeah, is it blood genotype? Yeah, what's your blood genotype? Okay, so I'm AA, I'm AS, we're good. What is it important for you? Now, I'm going to ask about the blood group. Yeah. Is it important to check for the compatibility of blood groups as well when you're getting married, especially for the rhesus factor?
Well,
Or does it matter? It doesn't matter, no.
I don't think it matters. I don't think it matters much per se, because it's good to know it. Because if you know it, then as long as the woman is having the baby in a right place, they can be prepared for it. So if you know the person is positive or negative, your doctors, as long as you're seeing the right people, they can prepare for it. And I think that's not enough reason to say I'm not going to get married. But again, it's individual dependent. But at least that knowledge, like we mentioned earlier, will help you and your doctors looking after you prepare for an eventuality of the husband's blood crossing or the baby's blood crossing into the mother.
We're talking again in civilized conditions. Yeah.
So yes, so at the end of the
Yeah.
day, when you look
Say
at
yeah,
it,
I'm not gonna better because I'm not that government then you be
well, the thing is that when you look at it, a lot of the testing costs money, and for those people for whom the money may not even be available to do the testing, that option is not even there. For those who have the resources to have the testing done, there are probably those people living at home who will not have the opportunity to make sure that whoever they're having the baby, which facility they're having the baby, is well equipped to kind of handle that eventuality. So I think it works out. Those who can afford the test are likely to be the ones who can afford the outcome of the test. And as they say, one of the ethical issues about doing a test is don't do a test if you cannot provide an answer to deal with the results of the test. So if we're doing
Oh,
any genetic testing, you know what the results could be, and we need to be sure that you have the resources, the facilities to take care of what could come out of the test. And if you don't have that, do not do the test in the first place.
is it for the doctors or for the people themselves?
Well, firstly, for the clinicians doing the testing, you must have proper genetic counseling before you go ahead and offer a test, because counseling will tell you what are the pros and cons of the test, what could be the outcome of the test. If outcome is A, what will you do? If outcome is B, what will you do? Have all of that conversation before the people should go ahead and do the test.
My goodness. So this is a huge resource venture. It's a resource venture, yeah, because we would have to have the personnel to do the test, and then we also have to have the backup support for when the test is being done.
Oh, definitely. And this is one of the problems we have now with this genomics and next generation sequencing coming in, and it's becoming more. A lot of these things, the good thing about the NHS is that a lot of these things have been made available via the public sector. Now you have the private sector going more and more into blood and saliva testing for abnormal genes and all of that. People are just going online and then they send you a kit and then you come back with 100 results. You now bring those results to us as GPs and we look at it and say, we have no clue what this is about. And that now it becomes a situation where people now go into a lot of anxiety, stress, depression, because they have results that tell you you have 1 in 175 chance of developing this condition. What does that mean? We don't know. So a lot of these complex results are difficult to interpret. Two is that you have results that you don't know what their significance is. It tells you this is your risk. What does that mean? Am I going to have this condition? Nobody truly knows whether you have it or not. And that's where a lot of the cons of some of the testing, are some are straightforward, like sickle cell disease, cystic fibrosis, but a lot of these newer generation tests that will find out you have this trait, which is quiet. It may not show up in you or your children. It may show up in your children's children. I mean, all that kind of complex information of what use it is. So those are the kind of the negative aspects of testing. And there's some things also we need to know. You can go and do a test and find something, and then something unfortunate happens. Your dad is tested, he doesn't have any of that gene. What does that mean?
Oh, okay. I get it.
Yeah. So that's some of the things that could
Yeah.
happen. You find
Yeah.
something and then you want to test your parent. One of them doesn't have any of that gene, and they're supposed to have half of that gene, which is from you. You now find out maybe you're adopted or your father is not your real father and things like that. So unfortunately, these are ethical issues that can come up with testing. And that's why I'm saying that ideally, before you decide to test, all of these things should be discussed with you. And then whatever you decide to do, you're doing it based on having the information on both sides.
So in a society like ours, even though this topic or this conversation is very important, you shouldn't just go ahead to do the medical screening unless you have the support, the backup support, whatever the support is,
Definitely.
after
Definitely.
the post-test support.
Yeah, definitely. So the
Yeah.
same thing goes like PSA. We always tell black men you're 4 times more likely to have prostate cancer. So go and get tested. But for you to get tested, you need to know that PSA, the prostate specific antigen test, it's not a good test for prostate cancer, but it's the only test that exists. So somebody can have a positive test, but it's a false positive, which means that the test says you have high risk, but it's actually positive. I mean, it's a wrong result. And I can have the opposite. The result says, oh, your result is very good. That's a false negative, gives you false hope. And then the next thing, 6 months later, you're down with prostate cancer. And that's where screening also has its problems, that you need to be sure that what you're testing, it says it does what it says on the thing. So that again is a problem of testing. So really having a balanced information, knowing the benefits, knowing the challenges, and you can now make informed choice for yourself.
Fantastic. I have a question here. Somebody says, business of chasing money. And this is about people who live in the UK or live that have jackpot as single parents. Any thoughts for single parents, please? We talked earlier about the impact, the
Yes.
importance of having both parents in the family and how that significantly affects the mental health of Black children. So this person is asking, for those people who are from single parents households where the bills have to be paid, what can they do?
It's a sobering question, and it's something that we have to reflect on very carefully. Like I mentioned, I know some single mothers who have walked around the clock trying to provide material things for their children to try and make up for their fathers not being there for them. Now, this may also be the case for single father households. But what I say is that I've made that mistake, but luckily my wife was there for some of that, in the sense that there are those few years, I think after age 7, I think a lot of the early child year is when our children need us most. And if we're busy working and making money to buy them gifts, and they don't have us there to give them that parental love, those things that they see more than what you say, and they lose those things. Some of these children end up having low self-esteem, looking for love outside and things like that. And that's why we need to have a balance, that yes, it's good to make the money, but try and look at it that spending time with the child or with the children is, you must ring fence time for that child. Make less money if you have to, knowing that that time you're spending with the child is an investment. You're giving in-kind wealth to that child. You don't want to do all of that hard work, pay all those bills, and then when the child is now a teenager, he or she is on the streets, and all your hard work or working so hard has gone to waste. So trying to have that balance between having time for the child. A lot of the children, we have Black families where the mothers and fathers are not there to attend parents' evening. All those are kind of things that we must be there for the children. The child has homework. Many of us are not there to watch the child do their homework because we're chasing money. So we need to have a way of balancing chasing the money and providing parental care for those children in those formative years of their life.
Yeah, I get it. I mean, and this is the sad reality of life, that sometimes the parents just have to do what they've got to do because they don't have additional support. Like in a family where the mother has to has to do what she has to do. It's just unfortunate that happens. Ideally, we should be able to attend the children's parent PTA meetings, but sometimes reality just throws us off into a situation where we can't do it, not because we don't want to, but because of the pressures that exist, that the bills have to be paid. And sometimes some of the financial commitments that we have, sometimes some people are not even looking for too much. It's just to even keep up with the daily, day-to-day sustenance,
Just to add to that, I mean, I know we were lucky in the sense that bringing up our children, we had a strong Nigerian community, and we're kind of, for those of us who were involved in the community, we're there for each other. I know with all the rules and regulations, it may not be that easy, but being part of a community sometimes helps. So that if you have to go somewhere, if somebody could go on your behalf, for the child, or you can drop your child with an auntie. I mean, it's not easy as long as you reciprocate, not that one person always doing it and you're always going off, but
Yeah.
you're there for this person, they are there for us. That way we can be in a strong community, we can be there for one another, particularly for single parent families.
The net that works.
Yes, exactly.
Okay. So, and again, now I'm going to ask, when couples find out that they are genetically incompatible, what's the right way to handle the conversation? Can love push through, or is the cost too high? And I think that you've kind of like answered this, but I want us to answer it on its own.
Right. Okay. I think it's well, yeah, like you said, it's for them to make the final decision. If one parent has, say, a dominant gene, which will definitely be passed on to the child, then that's a big one that you need to think about it carefully. There are some conditions there's a 50% chance that the child would have it. But where it's a recessive gene where there is a 1 in 4 chance, then I think it's for the couple to look at what it means to them, that if this happens, they can either speak to those that have the condition, read about it, see what happens, and then make an informed choice about where to go from there. But I think it's really disheartening if you have done all the testing, you have all the information, and if you now make a decision hoping for the best, and then at the end of the day, you have a child who has a disease, that means that, but if you love each other so much, and love covers a multitude of sins, but I think that's a decision that you have to make because it's a difficult role when you place to be when you see what your life is almost mortgaged looking after that child. And those are things that people have to think very, very carefully before they get themselves into saying I do.
Yeah, because when you are looking after a sick child, it erodes the romance, it erodes the passion. And I think one parent sometimes is the one that has to be around more than the other. And then excuse my French, guys. So now let's go back to the community. What role can community leaders, faith groups, and schools play in making premarital screening more normalized and less of a taboo?
It's interesting. I mean, now to answer that question, I look back at research. I think in Saudi Arabia, I mentioned in India, in some countries, premarital screening, like we said, is been made more or less compulsory. And there's evidence that where you make it compulsory, the number of children who are born with these diseases like beta thalassemia and so on, they are reduced. But there's also the issue of how do you marry that with culture and tradition. So first and foremost, it's now shown that where genetic education is incorporated into primary and secondary school education at various levels, young people come to know these facts and they are more likely to voluntarily want testing done. And because the young man and the young woman have had this knowledge from their young age, they are more likely to make informed choice. So that's quite a useful one. And then involving community leaders as well as religious leaders in education around genetic counseling, looking at the pros and cons, because a lot of us have significant others. If GO or whatever we call our men of God, if GO on the pulpit says it's a good thing to do, God has given you wisdom, more people in the church are more likely to do that. If the king or the emir or the OB says that, or the Amayanawa says that it's a good thing to do for us to look after ourselves and be prepared for marriage, is also more likely to happen. So involving community leaders in the education and knowledge, first of all, having a school educational system on genetic counseling, the genes and all that, and then having our faith and community leaders educated and having them on board to be part of the program also makes it more successful over and beyond involving us as clinicians. Because even me as a GP, I mean, most times the first time I see a woman is when she's told me she's pregnant and she wants to book in with the midwife, or her period is late, she wants to check whether she's pregnant. So there are very only women who have had issues. Maybe in her last pregnancy she had diabetes, or she has an issue, she had a miscarriage. They said, okay, I've had 2 miscarriages. I want to prevent it from happening. That is the only time, or someone is trying to get pregnant, she can't get pregnant, she now comes to us for advice, for referrals. That is when premarital, discussions take place. But for the vast majority of women, we see them the first time when they are pregnant. And that's where having that knowledge ahead of time would help people in our communities begin to know about it, know the pros and cons, and then go get it.
Can infertility be passed on genetically?
Well, technically, yes, in the sense that there are so many causes of infertility. It's from the brain to the womb, to the ovaries to the womb. So if somebody has issues with the ovaries, from a genetic point of view, that can be passed on. If somebody has a condition that maybe the tubes are not working, that kind of gene could be passed on. So yes, technically, it's not impossible to have conditions which are like recessive, and after many whatever they can be passed
Dominant.
on. But having
Yeah.
said that, the common things are the most common. So most times infertility things are linked to obvious things with the womb or the ovaries.
And what about for men?
And well, for men again, it's the commonest problems is lack of sperms in the man. And again, as rare as that is, there are some conditions like Klinefelter syndrome. There are some conditions which are linked with infertility in men, but they are quite rare. But yes, there are.
Fantastic. So again, this is an interactive session. So if you have any questions or comments that you'd like to ask Dr. Goma, please feel free. You can, if you want to ask him, you can use the interactive button and raise up your hand, and you can ask him the question. So I'm just going to give us some time to ask him questions. Don't be shy.
Maybe I've answered all their questions.
Yeah. Questions, please. You can use the hands, yeah. Let me see, somebody's saying something here. Somebody says, thanks, doctor, great information. Any questions? Thank you for that. Any questions? Okay, so give me one message would you give me one message that you would give to any couple preparing for marriage about the importance of screening?
Right. Ibi, compatibility is not just romantic, but it's medical as well. And by combining screening with counseling, and healthy conception habits, having open communications, couples can plan with clarity and confidence, and this will strengthen their bond and lay the groundwork for a healthier family and the future of mankind.
There's something you said. I want to ask you this question. What do you mean by healthy conception habits?
Healthy conception habits is the woman's womb can be perfectly prepared to receive the baby, or it could be haphazardly prepared. And a healthy conception habit is making sure that that baby is going to have the best start in life. A woman whose weight is great, a woman who has sufficient folic acid, who has sufficient iron, who has sufficient vitamin D, who doesn't smoke, who does not drink alcohol, who keeps fit, does regular physical activity, who is happy, who sings a song in the bathroom. All of these provide a healthy conception habit for the child.
So I think I'll start singing
Exactly, exactly.
for myself. I'm past childbearing age.
Well, I
So,
know I'm too sure.
yeah. So, I mean, this is a fantastic, fantastic conversation. And I think on the 12th of July, I have another guest coming in to speak on how to, what is he saying again, Seth? He's going to speak on how to resolve conflicts in marriage without losing the spark. And after that, I'm going to have Dr. Amoni Gaspar talk about dementia in women.
Wow.
So follow me on my social media handles, Ibinabo Enebi, and on YouTube, and then I can, so that when I post the flyer, you'll be well aware of the dates. Singing, you say, at what age again do you want to have children? She's trying to slacken me. This one is yabbing me. Singing, you say, at what age again do you now want to have children? I'm not one born again. No worry, I'm done born finish. So, Dr. Goma,
Yes.
I just want to say a huge thank you for this insightful conversation. But there's something that we talked about before we had the conversation. And we talked about the complexities of genetic screening. Like where we said, you cannot tell them not to do it. You can't tell them to do it, but it is a decision that they have to make for themselves.
True. True. I mean, at the end of the day, it's an ethical thing. The decision to go for counseling has to be made by the man and the woman. Our responsibility is to give them the information in a balanced, fair way and let them decide whether they want to do it or not. I always say it's your life. It's not mine. And, at the end of the day, as an NHS GP, I will always get paid my salary. So my duty is to give it the information and then you take it in. I trust you. You will make informed decision and that decision is the best for your family. And premarital screening, it sits at the crossroads between public health and personal rights. So on the side of public health, things like hepatitis, things like HIV is important. But on the side of the individual, it is your life. You have the right to make a decision on what to do. And I wish you the best in making your decision.
Fantastic. So thank you very much, Dr. Goma. And I'm going to call you. And I want to thank everyone who's been here. And we've had quite an interesting, and a lot of them stayed. And so just in case you're watching me for the first time, my name is Ibinabo Enebi. And please, to help my YouTube channel grow, kindly subscribe to my YouTube channel, Ibinabo Enebi, and follow me on my social media handles, Ibinabo Enebi, Instagram, TikTok, Facebook and LinkedIn, so that you can be abreast with my upcoming events. Dr. Goma, I'll call you. And thank you everyone for joining us. Oh, somebody has a question here. Ooh, 1 minute. Question. Somebody, okay. Thank you. Somebody's saying, well done, well done. So, Dr. Goma, thank you. And thank you so much, everyone, for joining us today. And on the 12th of July, I have another interesting conversation in our love and relationship series. So, join me then. And bye, everybody. Mwah, 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 mwah.
All
Bye,
right,
Dr. Goma. I'll call.
okay.